Oh, my chair is something else. Hi guys, welcome to my channel. I'm gonna try to be as enthusiastic as possible because I just made like 3 videos, 22 minutes, 17 minutes long. We're gonna keep the same energy, okay? Well, this video is gonna be about, let me see, my coffee is done. I need to play some music. Well, after this video, I'm gonna play some music. Okay. Alright guys, so this video is gonna be about some immune or neurodegenerative and neurodegenerative conditions, okay? And these are like what I noticed. This is the minimum that I got because there's just a lot of information. Is this, hold on, 1 2 3 4 5 6 7 8. These are like 8 conditions, and sorry, yeah, it's a lot, but these are the main things that I got from my research and, you know, digging into different things. So first is MS. Myelin sheath. MS, nah, it's not myelin sheath. MS is multiple sclerosis. It is it has to do with an immune problem that would affect the myelin sheath. The important thing to know about this is the myelin sheath. What is the function of it? Our myelin sheath helps insulate our nerves to promote good transmission, to promote good nerve transmission. Yeah, so if there's a problem with the myelin sheath, then we're not getting a fast enough relay of information across the axon, across the axon. Yes, I think it's the axon. So then this mostly affects your brain, like your central nervous system and your spinal cord. So what does this mean? The way I thought about this is if it affects your central nervous system and your spinal cord, that means that it can affect, let's say if it's your brain, it can affect your cerebellum, which helps with coordination, as in balance and walking. It can affect your optic nerve, cranial nerve number 2, which is your eyes. So you'll probably see something called diplopia, which is double vision. And from the spinal cord, the nerves that innervate your bladder muscles. So you might have like incontinence or urinary retention, problem regulating your bowel movements and things like that, constipation or diarrhea. What other problems might you have with this condition? Also, another important thing about this condition is you really want to avoid extreme heat or extreme temperatures, which is extreme heat or extreme cold with these patients. And you also want to have them stay away from stress. Like, these people should not be going to nursing school. Oh my god. Anyway, nursing school is not as bad if you have everything else sorted out, though. Yeah, it's still bad, but it's worse when you... Anyway, I'm going off tangent. Just trying to make this a little bit more fun, Yeah, so we talked about the optic nerve, we talked about the cerebellum, we talked about innervating the bladder, and we talked about balance, which might cause ataxia if there's a problem with the myelin on your spinal cord. Also your cognitive, since it's CNS, cognitive, which means your ability to remember, to make decisions, to basically symptoms of, like, it might lead to symptoms of dementia. And there are many different forms of this disease. So a person might have it and they might just look like regular. So the one that is very common is RR, which is remitting and relapsing and remitting. So they have periods of exacerbation and like flare-ups and relaxed times. So that's why we need to know things that make it worse, which is stress, extreme temperatures. We want to have them stay away from that. So that is really all I have for MS. Actually, no, when it comes to the treatments, you can give things that would decrease the immune system, as in you will give like prednisolone IV, or you can give the MABs medications, and you shouldn't be given to patients who are 16 and over because it can cause extreme seizures. Or another immune one, which is interferon. The next condition that I will talk about is MG, which is Myasthenia Gravis. This affects the acetylcholine, as in the transmission of the neurotransmitter acetylcholine at a neuromuscular junction, like the connection between two nerve fibers, causing muscle weakness. And it's important to know that myasthenia gravis, it would affect the muscle, so definitely will cause muscle weakness. It would affect muscle weakness, but because it's a muscle problem, it's not going to affect your sensory or your coordination or your cognitive. So it's not going to affect your cognitive, but it would affect your muscles, as in your ability to breathe, probably your ability to swallow, your ability to talk. So we'll mostly see this, since it's a motor problem, we'll mostly see this in the face overall. We said with Bell's palsy, it was one side of the face. With Myasthenia gravis, it's the whole face. So they might have like a bland face, just like droopy face. The eyes might drop just like Bell's palsy, and we might have to tape it closed with an eye shield so that they will not have that ptosis or diplopia, double vision. Also, the thing to know about this is also, like I said, swallowing will be tough due to the weak muscles there. The thymus will also be inflamed, so we might do a thyroidectomy to remove the thyroid, and we'll give a medication. I think it's an anticholinesterase inhibitor. Then it will stop acetylcholine from it will stop the absorption of, or the breaking down of acetylcholine, increasing it in the body. A great example of this would be pyostigmine, like the medication ending in mine. I get in trouble with those endings sometimes now. But medications ending in mine. So that is really all for MG. So with MG, we see muscle weakness. It's motor, not sensory. So it will not affect sensation, it will not affect cognition, just the muscle. And because it's a muscle, it would affect your breathing. It would affect even the muscle that helps breathe. It would affect your ability to swallow, and drooping of the face. That's the ptosis, right? So then the next condition is called GBS, which is still an immune thing. Again, I forgot with myasthenia gravis, I said pyostigmine, but we can also do, I think it was called TSC, or plasmapheresis. I don't know what that is, but pretty much kind of filter the blood, removing some of those antibodies. GBS, which is Guillain-Barre Syndrome. When I think of this one, I just think of weakness, ascending weakness from the bottom to the top, and it's caused by a viral infection. Let's think about this. Guillain-Barre Syndrome. When I think of this condition, I think of low reflexes, hyperreflexia. I talked about viral respiratory failure, because I guess it's still the muscle. With GBS though, it affects the myelin sheath too, but it is peripherally. So because it is from the peripheral nervous system, it usually doesn't affect your cognition. I didn't write that down, but I'm thinking it's not going to affect your cognition because it affects your peripheral nervous system. So with GBS, ascending muscle weakness, which eventually will lead to respiratory failure, trouble swallowing, low reflexes, autoimmune, again, we'll probably treat it with the same drugs as is it MG, except not the cholinesterase medication. Yeah, usually with GBS, the patient recovers completely because I forgot the specific myelin sheath that are affected, but yeah, that is that for GBS. So those were the autoimmune conditions. So now with ALS. ALS is a neurodegenerative condition, and it affects the spine, the anterior horn of the spinal cord. It affects the anterior horn of the spinal cord, which would help with the nerves innervating the muscle, causing complete muscle weakness. So let's say like the entire body, you might have contractures, risk for clotting and things like that, but the patient is clearly awake, like the brain is functioning and everything, but they are just like stiff like this in the bed, and eventually they die of pneumonia because they forget how to breathe. And yeah, so yeah, that's really it, muscle weakness. And then you have another muscle weakness condition, which is muscular dystrophy, a really common disease. This is genetic, and a common disease is Duchenne's muscular dystrophy. So it just causes overall muscle weakness in the body. It's a dominant gene, so if you have it, your child is at 50% chance of getting this disease. It can affect your spine, your ability to breathe, also pneumonia, and then you end up dying. Another condition is Huntington's disease, and Hunches disease is also a genetic condition. It affects the basal area of the brain. I think it's called the dominant Mendelian gene. So with this, it causes like Parkinson-like symptoms, chorea, hallucinations, involuntary muscle movement, yeah. Loss of cells in the striatum basal ganglia. So we have Parkinson's. Parkinson's is a disease that is caused by low dopamine, and it's mostly common in men in the 30s and up, or 50s, but we've seen it in 30s. This causes this lack of dopamine causes the 4 cardinal symptoms of Parkinson's, which is a shuffled, which is bradykinesia, which is slow movement, a slouch posture, muscle rigidity or body rigidity, and the last one I forgot what it is, and tremors. And the tremors happen at rest. So let's say like they're resting and then the hands just trembling, and with movement it goes away, right? So that's what that is. And it can also, it definitely will affect the patient's balance. So in order to fix this, we want them to like widen the gaits. It causes propulsive gait too, where they have to keep walking, because if they stop, it's like, it's like a depressed on the brake. Slurred speech, possibly some drooling. What else? Also, it's a gradual onset. It starts slowly. Before you know it, the patient has it. And what we can help with this is giving levodopa and carbidopa. Levodopa will increase I'm having a
Headlines I found disconnected.
Levodopa increases dopamine levels in the brain, and carbidopa helps it stay in the brain. Yeah, so we can give that, but we want to really wait to give that, because within 2 years of giving this medication, it can cause some other side effects called dyskinesia, which is one of the symptoms of antipsychotic medications. I believe like the not thyroid dyskinesia is an emergency, but extrapyramidal syndrome, like movement of the head and hands like that. Yeah, and in order to fix these symptoms, we'll probably give benztropine to help. And with knowing the signs and symptoms of benztropine or the side effects, will be anticholinergic symptoms where everything is going to be dry, dry eyes, dry poop, dry urine. Yeah, so that is that for Parkinson's. Then the next condition is called degenerative disc disease. It's pretty much like very common in the US, like back problems caused by pressure onto the spine. And it causes a disc to press on the nerves in the spine, which will result in trauma and something called radiculopathy, which is pain. Damn, I don't know what it is. I think it's like pain at the nerve root, like damage to the nerve root. Yeah, so disease of the spinal nerve root. It causes so much pain. So usually to treat this, we'll usually ask the patient to just rest, relax, and we'll probably give some anti-NSAIDs, antipyretic medications, or pain medications for this. So that is that for the conditions, and I hope most of this is also stuck in my brain. Okay, so pretty much ALS, the horn, it affects the muscle, the nerves that help with breathing, and is degenerative. Parkinson's, dopamine causing the 4 cardinal signs, which we talked about, bradykinesia, posturing, bad posturing, tremors, rigidity, GBS, which affects the peripheral nervous system, which is causing ascending weakness, eventually leading to respiratory failure, which is caused by viral infection, but it's treatable. Then we have MS, which is, these are immune. MS affects the myelin sheath of the central and peripheral, and we talked about the fact that the innervated muscles, such as the urinary, is affected, and MG, which affects the neuromuscular junction, where acetylcholine is released, causing muscle weakness, and even inflammation of the thymus, and the fact that we'll give pyostigmine, which is an anticholine cholinesterase inhibitor. And with this also muscle of the voice, like dysphonia. Okay, it doesn't affect your sensory. MG affects motor, no sensory or coordination. Okay, so it's just the muscle. And we talked about muscular dystrophies, which affects the muscle only, and Hunches disease, which is a genetic condition affecting the basal ganglia, is a dominant Mendelian gene. All right, thank you for watching my video. I talk too much. Thank God I have something to talk about. All right, thank you for watching my video. Thanks. Bye.